All right, edema versus pneumonia. First thing we notice on this case is how busy everything is. We have all of these lines going throughout both lungs. These are called interstitial opacities, interstitial, meaning they're spreading along the scaffolding of the lung. When we look at the distribution of them, these are symmetric because they're affecting both lungs equally, and diffuse, meaning it's not focal to one area and it's not centered around the heart. Also have to look for the rest of the context clues in this case. So look at the heart size here. This thing is a normal heart size. We say normal because it's less than half of the total width of the chest. We can also look at the heart borders, and these are nice and clean and crisp heart borders over here. And finally, we notice some other opacities here. These are different from those linear interstitial opacities. These are going to be airspace opacities, meaning stuff is also filling the airways. So we got symmetric, diffuse, interstitial opacities with some patchy airspace opacities at the bases and a normal heart. This is more consistent with a pneumonia. Let's compare that to this case here. We have linear opacities over here, so we have some interstitial opacity, but we also have these airspace opacities, which are centered around the heart. Distribution here is symmetric, but it is central. That's your key, central. We also notice how big this heart is compared to the last case, and we are losing those heart borders. Can't even really make them out in this case. They're really indistinct. So in this case, we have symmetric central predominant opacities with this almost bat wing appearance of the opacities. This is consistent with edema, and more importantly, it's going to be cardiogenic severe pulmonary edema.